Hi, I'm Dar Hafner and I am a member of the ICSI Patient Advisory Council. And I also volunteer at Methodist in several different areas. And Methodist is always striving to improve their patient-family experience in the hospital or in the clinic. And one of the new things that they're doing, a new technique, is we are actually former patients or former family members are actually rounding on patients in the hospital. And it all got started when it brainstormed and a couple of administrators thought, we have a lot of patients on different committees doing a lot of different things, and let's try patients actually rounding on other patients. And I think it's a valuable strategy in the fact that it's patients, you're on the same page, you can actually go into a patient's room and say, you know, I've been there, done that. I know what it's like to be in the hospital for a couple of weeks, to have that procedure done. And I think it can just be really powerful to share that experience. And one of the experiences that I had is I went into a woman's room and I said, you know, I'm just a former patient. I just want to talk to you about how your hospital stay is doing. And she looked around and she said, you know, I really want to talk to you. Can you close the door? So I got up and I closed the door and she said, you know, she said, I have a concern that I can't talk to a nurse or a doctor about. And she said, I don't feel that I'm having a good rapport with one of my nurses. And I feel it's my fault that she doesn't like me. And I just felt so bad for her. And I think what was really important is we were able to talk about it, we resolved it, but after I left her room I thought, you know, what if she went home after her hospital experience and felt, no one listened to me, I couldn't talk to a nurse or a doctor, I didn't want to complain, and she felt that her experience wasn't good. And this way, talking to another patient, we had it resolved and she felt she was listened to. And I think what's really important in the patient rounding is a patient can go home and they can say, somebody cared enough to talk to me, listen to my concerns, and didn't just listen, but they were proactive and they did something about it. And I think it's just a really powerful message to that we want to improve that patient-family relationship, and I think it's a good strategy and it's a good step, and I think it's in the right direction. And maybe other hospitals might take on that new strategy.